I took these pictures in my last trip to Somalia in 8th of July of 2009. Due to security situation, we are based in Nairobi, Kenya, with the rest of the international staff, and we are able to go to the field once or twice a month, just for a short visit. Since 2008, the national Somali staff are running the project by themselves with the support of the international staff.
Before MSF Jamaame was no hospital at all. There was a small pharmacist who are not caring about the people, and they don't know how to diagnose and treatment of the patients.
Most of the people they flee from Mogadishu. They live in southern Somalia. They come and look for medical facility.
You see, we are having too much malnutrition in Somalia because there are no foods that people grow in this place. Also, there is a lot of drought, which is going extended drought, which is going on, and also there are poor people who cannot also go to the farm, who doesn't have farms, and also who cannot afford to go and plow and prepare their farms.
MSF is treating malnourished children in Jamaame, and we are able to admit in our 20-bed therapeutic feeding center the most severe cases. Mostly all the children are arriving early in the morning, some of them after being walking for a long distance. Often they have seen traditional healers before coming to us.
There was a child who was brought from Kismayo. The child has suffered so much. If you see the body of the child, you don't think this was a human being or what. So after being given those foods, the child became recovered and became well, and the mother was very happy to see that the child has recovered.
Sometimes patients come too late and it's nothing that we can do for them. When I took these pictures, this man was taking his son who died recently to be buried. I was impressed by the dignity of this man. MSF has set up a maternity ward with capacity for 10 beds, where women can deliver safely with the support of training staff.
We feel the many problems about maternity side. The women mostly they deliver at home because in the area in Jamaame or in Lower Juba there is not any hospital for covering the maternity problems. The maternity and mortality is very high.
The hospital has as well 40-bed inpatient department where we can hospitalize the more severe cases. In this picture, you can see how one of our nurses are doing the daily dressing for an old woman who burned 70% of her body. I select this picture because in her hands, in the line of the hands, you can see the pass of the time, the suffering of the Somali population, and the way that the relative is holding her hands show the respect that the young generation has for the elders in Somali culture. Since we arrived in 2007, we are running an emergency room 24 hours a day, 7 days a week, where patients can have access to health care in the middle of the night. Mainly the cases that we can see are domestic and traffic accidents and violence related. What really made an impression to me in Somalia is the pride and the dignity of the Somali population. Despite of all these difficulties, they always find a hope for a better future.